So thank you for joining us, Tom. Would you be able to go through with us what sort of signs you were seeing on farm?
Absolutely, Catherine. So the farm in question is a 240 cow milking herd all year round, Holstein Friesians. Generally, well, they're vaccinating for leptospirosis, IBR, and BVD, and we've looked at Neospora in the past as a introduction. The clinical signs we were seeing was we're having sporadic abortions, kind of 3 months to 8 to 9 months gestation. We were also getting quite a few early embryonic deaths and seeing several cows which would come bulling at 25 to 32 days. And then also we were getting a few a bit later kind of post PD as well.
Perfect. And what diagnostics did you do at the time?
Yeah, well, so like I said, I mentioned the Neospora. So we had a spell of Neospora historically. We felt we'd rule that out. The farmer went through the whole herd and sampled them, and that was probably 2 or 3 years ago. Anything that aborted in the meantime, we have consistently continued to do Neospora blood testing to rule that out. And then we were looking at Salmonella on the bulk tank. That never came back particularly high. And we did some individual Salmonella blood serology, and maybe 1 or 2 out of about 10 or 12 cows that we did came back positive. But we did the Q test on the bulk tank. That came back negative, but nothing if not persistent, and so I did some bloods for Q fever on serology, and that came back positive. Out of the, I think, 10 animals we blood tested, it came back positive on 7 or 8.
And were they the cows that had aborted, those blood test ones?
Not all of them, no. There was a few which were just repeat offenders that would be positive on a PD, and then a few days later, maybe 10 days later, 14 days later, they would then come bulling again at about 50 days post insemination. So we also looked at those as well.
And what made the farmer decide he wanted to vaccinate?
I mean, really, it was a diagnosis, as you can see, a diagnosis of last resort, really. We'd kind of looked at everything else, and Q fever was the only thing that stuck. And so we decided it's probably worth a try. His inter-service interval for the 25 to 32 days post-service had got worse, and we were getting these abortions that were just sporadic, and he was getting a bit down in the dumps about it. So we decided we'd give it a go with the vaccine, and so that's how we decided to vaccinate.
So we're about a year on from vaccination now, and how's it going on farm?
Yeah, really good. So the farmer, I had a chat with him before the interview. He said he's really pleased with how things are going. He's hardly had any post PED returns like he was having. His 25 to 32 day inter-service interval has much reduced, so we're back down to about a third in that window compared to 18 to 21 day inter-service interval. And we've had half a dozen abortions. We have had positive results on so these are stillbirths, so probably half a dozen stillbirths and abortions, 2 or 3 of which I think we've put down to Schmallenberg in the end, and I think we've had actually 1 come back as positive for Neospora. I mean, we said when we started the vaccination protocol, we said there's going to be a proportion of our herd which is still going to abort and still going to be responding or being affected by Q fever, but we've definitely seen an improvement since starting to vaccinate.
Good. And how's the farmer feeling about his vaccination program now?
I mean, he doesn't like having to vaccinate, but no
He
farmer
does.
does. But I think because we're seeing the results, salmonella results are still low, so we're not looking at that in any way. The cows are not aborting like they were, and just seeing the response that we've had, I think he's happy to continue. So we've done the booster, the 9-month booster, and so yeah, I think it's going well. He's happy with it.
Good. Perfect. Thank you very much for your time, Tom.
It's my pleasure.